Hi there, this is Nursing Education Videos. Today I will be going over the Barbiturates Anxiolytic and Sedative-Hypnotic NCLEX Nursing Questions Quiz on RegisteredNurseRN.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I'm reading goes to Sarah at RegisteredNurseRN.com. Again, all credit for the information that I am reading goes to Sarah at RegisteredNurseRN.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Barbiturates NCLEX Questions Quiz for nursing students. Barbiturates are medications that have anxiolytic, sedative, hypnotic, and anti-seizure properties. Barbiturates are medications used prior to surgery, treatment of seizures, etc. The nurse should be aware of how these medications work, why they are ordered, nursing implications, adverse reactions, and how to teach the patient how to take the medication. This quiz is part of a pharmacology NCLEX question review series and will include various medications. This series will test your knowledge on nursing implications, side effects, patient teaching, therapeutic effects, and more. Don't forget to watch the barbiturate lecture and review the notes before taking the quiz. Barbiturates Sedative-Hypnotic Drugs NCLEX Questions Quiz. Which statement below is incorrect about barbiturates? Barbiturates are not as commonly prescribed today for conditions like anxiety or insomnia. Instead, they've been replaced by the benzodiazepines, which have a lower risk of toxicity. Barbiturates have a low therapeutic index. Barbiturates decrease the effects of GABA. Barbiturates are a central nervous system depressant. So we'll go to the review notes. So it states here, barbiturates amplify the effects of the neurotransmitter GABA by influencing GABA A receptors. GABA is an inhibitory neurotransmitter. So this would be C. Barbiturates decrease the effects of GABA. Question number 2. Select all the medications below that are classified as a barbiturate. A. Midazolam. B. Phenobarbital. C. Primidone. And D. Lorazepam. So the question says select all the medications below that are classified as a barbiturate. So we have here phenobarbital is for seizures and increased ICP. Primidone is for seizures. So it would be B and C. Question number 3. Which barbiturate below can be prescribed for migraines and is used in combination with acetaminophen and or caffeine? A. Secobarbital. B. Diazepam. C. Budalbital. Or D. Temazepam. So we are looking for barbiturates. So it could be either A or C. So on the notes here, it says butalbital in combination with acetaminophen and caffeine are prescribed for migraines. Question number 4. Barbiturates affect blank receptors in the CNS. These receptors are considered blank receptors and consist of blank subunits. A. GABA B ligand-gated semicolon 4. B. GABA B G protein coupled semicolon 5. C. GABA A G protein coupled semicolon 5. D. GABA A ligand-gated semicolon 5. So barbiturates influence GABA A receptors, according to the notes, and are ligand-gated, or also called ionotropic receptors. And the receptor is designed with 5 sections, so notably called 5 subunits. So the answer would be D. Barbiturates affect GABA A receptors in the central nervous system. These receptors are considered ligand-gated receptors and consist of 5 subunits. Question number 5. Barbiturates cause what type of ions to flow into the cell and hyperpolarize it, hence leading to a decrease in firing potential of the neuron? A. Potassium, B. Chlorate, C. Sodium, or D. Chloride. So according to the notes here, barbiturates and bonding occurs, a channel opens to allow the movement of ions into the cell, specifically chloride. Question number 6. Barbiturates influence the receptor's ion channel to perform what action? A. Stay open longer. B. Open more often. C. Shorten opening time. Or D. Open less often. So it says here, barbiturates cause the channel to stay open longer. It would be A. Question number 7. Which statements below are true statements about how barbiturates differ from benzodiazepines? A. High doses of barbiturates can influence the receptor without the help of the neurotransmitter GABA. B. Barbiturates have largely replaced benzodiazepines for the management of conditions like anxiety and insomnia. C. The antidote used to treat barbiturate overdose is flumazenil. Or D. Barbiturates have a low therapeutic index. So which statements below are true statements? if you review the notes over here, so barbiturates have a low therapeutic index, a D, and then it says here high doses of barbs can influence the receptor without the GABA neurotransmitter binding. So flumazenil is for benzodiazepines. The correct answers for this question is A. High doses of barbiturates can influence the receptor without the help of the neurotransmitter GABA, and D. Barbiturates have a low therapeutic index. Question number 8. Your patient takes phenobarbital for the treatment of seizures. The dose has been increased. Which findings during your assessment require you to notify the physician immediately? Select all that apply. A. The patient has a history of tonic-clonic seizures. B. The patient's drug serum level for phenobarbital is 55 micrograms, so micrograms per milliliter. C. The patient has a deep tendon reflex of 2+. D. The patient's respiratory rate is 6. So the notes here, the range for phenobarbital is 15 to 40 micrograms per milliliter. So 55 micrograms per milliliter is quite high. So that would be something to require you to notify the physician immediately. Patient's respiratory rate of 6. So a normal respirations is 12 to 20. A respiratory rate of 6 is quite depressed respiratory rate. So according to ncbi.nlm.nih.gov, deep tendon reflexes, clinical methods, NCBI bookshelf. Deep tendon reflexes are graded as follows. 0 equals no response, always abnormal. 1+ equals a slight but definitely present response, may or may not be normal. 2+ equals a brisk response, semicolon, normal. So the patient has a deep tendon reflex of 2+, that would be a normal finding. Abnormal lethal finding would be absent reflexes. Question number 9. You are collecting the health history on a patient. Upon examining the patient's electronic health record, you note that the patient has a history of seizures and was prescribed to take a barbiturate to manage the seizures during the last hospitalization. The patient is unable to communicate the last time she took this prescribed medication. As the nurse, you will make it priority to monitor for what findings below that could indicate the patient is experiencing withdrawal. A. Elevated temperature. B. Restlessness. C. Convulsions. D. Vomiting and nausea. E. Sleep problems. F. Agitation. So the mnemonic for withdrawal symptoms is craves. C for convulsion. R for restlessness. A for agitation. V for vomiting and nausea. S for sleep problems. And E for elevated temperature. So as the nurse, you will make it priority to monitor for what findings below that could indicate the patient is experiencing withdrawal. So it would be all these. So A, elevated temperature. B, restlessness. C, convulsions. D, vomiting and nausea. E, sleep problems. And F, agitation. Question number 10. True or false? Tolerance is less likely to develop with long-term barbiturate usage. So tolerance can develop, according to the notes here, when the person cannot obtain the same effects from the drugs or from the drug and needs a higher dosage to get the same effects. It happens with abuse or long-term usage. So question number 10, tolerance is less likely to develop with long-term barbiturate usage. That is false. Okay, now I am going to input the answers and see what we get, or see what I get. Okay, here are your results. Your grade is A. Percentage of what you got right, 90. So let's review the quiz and see what I got right and what I got wrong. Okay, so question number 8. Your patient takes phenobarbital for the treatment of seizures. The dose has been increased. Which findings during your assessment require you to notify the physician immediately? Select all that apply. So the answers are B and D. Phenobarbital level of 55 micrograms per milliliter is too high and increases the risk of overdose/death. A normal level is 15 to 40 micrograms per milliliter. Barbiturate overdose can lead to respiratory failure and a rate of 6 is too low. So when I was inputting the answers, I only wrote B and I didn't input D as well. And so that's why I got it wrong. Okay. And then thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button and go to registerednursern.com for more information and check out their YouTube channel. And please share this video if you'd like to. Thank you again for listening and I hope you have a great day. Thank you.